New at 6, a Huntsville pediatrician says schools and parents have to enforce wearing of masks and social distancing if we're going to have any chance of stopping outbreaks of coronavirus in the classroom. WAAY 31's Max Cohan joins us live to tell us what else the doctor had to say about the return to school.
Dr. Kevin Ellis told me there's definitely a risk associated with sending kids back to school this year, and no one is expecting this to help case numbers go down.
Really, I can't emphasize it enough to wear a mask. I know that the students haven't seen each other since March, but do not share things, do not be in each other's faces.
Dr. Kevin Ellis says education needs to start at home. He says parents need to prepare their children, making sure they know the importance of masking, distancing, and sanitizing. Alabama's mask order that's in effect through August 31st requires students from second grade through college to wear masks, quote, whenever practical. Ellis warns that kids can still get very sick, but noted that children under 10 seem to exhibit weaker symptoms and lower transmission rates.
But you still need to be very careful. So it's a little safer to open up the elementary schools and some of the preschools than what it is for some of the upper schools.
Ellis says it's inevitable that the virus will reach every school and says there's a lot of debate about how far schools should let an outbreak grow before shutting down. According to Ellis, in cases of the flu, schools are shut down when 10% of students have it.
But for coronavirus, you've really almost risked a bad outbreak at a school if you wait till 10%. So I think many doctors agree that for coronavirus being more serious than the flu, then we need that number to be lower than 10%, but the debate is how much lower.
Ellis says he believes most people agree that number needs to fall between 1 and 10, but says 1 could only be a handful of cases and 10 is already an outbreak. Reporting live in Huntsville, Max Cohan, WAAY 31 News.